We'd like to welcome you all, our viewers this morning, this afternoon, to our panelist that's going to be talking to us today. We have Dr. Chris Stout and our co-chair for the webinar, Division 52 Webinar Committee, Dr. Falu Rami, who will be our moderator on this morning. We'd like to have you all get comfortable so that you can enjoy this morning's webinar. Just a few things that we want to talk about. If you please have any questions, you can write your questions into the chat box, and in about 10 minutes prior to the ending of this webinar, we will be taking questions from the viewers, and Dr. Stout will answer your questions. At this time, I'm Dr. Karen Brown, and I will turn over to our moderator, Dr. Falu Rami and Dr. Chris Stout.
Thank you, Dr. Brown. It is my utmost pleasure to introduce you to our speaker this morning, Dr. Chris Stout. Dr. Stout is a licensed clinical psychologist and the founding director of the Center for Global Initiatives. He published an award-winning 3-volume set, The New Humanitarians, and has written over 35 other books. He's received numerous humanitarian awards, including APA's International Humanitarian Award, and has 4 honorary doctorates. He also started a podcast titled A Life in Full, where he has conversations with inspirational people from various backgrounds that make a difference in the world and the lives of others. Without further ado, let me hand over the floor to Dr. Chris Stout.
Thank you, Rami. I appreciate that. And welcome, everyone. I'm very excited and honored to be able to spend some time with you this morning. As the title implies, we're going to be talking about a variety of different kinds of organizations and technologies. And I'll be providing a variety of tools for you all free of charge via our website that can help those of you that are interested in the humanitarian space and humanitarian intervention. Maybe to set somewhat of a context, let me start with my story. It's quite varied. I think I'll use a lot of road and car metaphors probably in this, but like you all, I think very few of us in the international space have one specific thing that we get involved with, and how we get to where we are today usually is quite a varied path. Historically, for me, I was on faculty at the College of Medicine at the University of Illinois in Chicago, in their Department of Psychiatry. That's where I started off. And now they have a Center for Global Health, which I'll show you some more information about, that I'm a part of as well. And it's kind of neat to grow into that. Western University. And back in those days, we were really working in the area of treatment outcomes in psychology and psychiatry. And one of the things that sort of became near and dear to me was taking a look at evaluation of the work that we do. And I think that also applies in the humanitarian space. And I'll show you some examples from some of the projects that we've been involved in and some of the kind of metrics that we take a look at, because they're a bit different than what we might be used to in terms of clinical treatment outcome in psychology. Parallel to that, I was involved with the TED conferences. Probably all of you are familiar with those of technology, entertainment, and design, or TEDx conferences or TED Talks. Back in the 90s, I was involved with the founder of them. Chris Anderson runs them now, but they were founded by a dear friend of mine, Richard Saul Werman. And Richard and I worked on, I was a contributing resource to him, an author to a book that he did back then called Understanding USA. And it sort of brought together some of those outcome kinds of things from a perspective of understanding prevalence and epidemiology of mental health in the United States. The T of TED with technology really was a focus of some of the work that I did also back in that era, with using computers and managing that to help do clinical outcomes. And some of the work that we'll talk about today aren't necessarily algorithms, but web-based kinds of platforms to be able to provide tools and things for you all in your work. And I'll heavily talk about the Center for Global Initiatives. It's a nonprofit 501c3 that I started back in 2007, and we'll talk about the ways that that came about. And then sort of, to me, in my conceptualizations of kind of what comes from looking at treatment outcomes is basically a foundation that then evidence-based practice can be predicated upon. So as Falu mentioned, a lot of the work that I did has been in the academic realm and doing a lot of books. I really enjoy writing. I really find that to be a wonderful way of to augment courses and to kind of help share ideas. And a lot of the work and a lot of the areas that I publish in, of course, is in psychology. But back in the day, I gave a talk in Cairo. That was really sort of one of the first times that I started to kind of tippy-toe out of psychology. I focused on still with psychology in behavioral health in terms of policy principles, as this book references, but it was a little bit outside of my comfort zone. I had some ideas, some concepts that I was working with, and I highly recommend, if that's a situation that you find yourself in, to put your ideas together in a talk or a presentation, and then share it with others and get criticism and feedback and vetting from different perspectives. This was a conference in Cairo, so it gave me a great diversity and a great richness, both outside of psychology, not being a psychology conference, but also not always a North American or a West knows best kind of perspective on some of my ideas, and being able to hear from other people outside of psychology what their thoughts and ideas were. It was very, very helpful, not only in, I think, better formulating my thoughts and ideas, but also in collecting some other kinds of contacts that then were contributors to this book as well. So I did a few chapters in this myself, but then edited the entire volume and brought other people's voices to the fore outside of psychology. Some of you may have participated in this or may be very well aware of it, but the American Psychological Association has had NGO status with the United Nations for a number of years now. And back in the late 90s, I think I might have my facts a little off, but I think this is correct, that Division 9 of APA, SPICY, actually initially had NGO status with the United Nations. And in that context, back in the late 90s, I applied to that and was able to go out to the United Nations. I was, I think, one of the first people to not be in the New York metropolitan area to be able to do that. And this was all pre 9/11, so it was fairly easy to get on flights and get off flights and make tight deadlines, more so than it is today. But it gave me this opportunity to go out. So literally for a year, every month I would go to the UN and participate with other psychologists that were working there at the United Nations. And it gave me an opportunity to meet who's become a dear friend, Harvey Langholt. Some of you may know him from his work or his reputation, but basically he worked at the United Nations under Secretary of State at the time, Madeleine Albright. And the work that he did was to help train UN peacekeepers with psychological kinds of principles in the sense of empathic listening and being able to work with them to manage the kinds of areas and to look in the area of where psychology can be helpful in peacekeeping. Then through our publisher, because I didn't know Harvey while my time at the UN, but my publisher put me together with him, Prager. He had done the psychology of peacekeeping, and she thought we would, be BFFs pretty quickly, and we were. And he and I kind of compared notes and created the psychology of diplomacy. So basically, we sort of parsed out our contacts and parsed out our interests. In the first half of the book, Harvey managed and pulled in, he wrote himself and pulled in colleagues from the diplomacy side of his time at the United Nations. And I pulled in the psychologist side from my time at the United Nations and put together this perspective on the psychology of diplomacy. So it was sort of a natural. I liked writing in these areas. Like I mentioned, it was nice to have this experience at the United Nations. And while the academic side was important, and I felt the work that was being done in that area was important and very enjoyable and really great, I wanted to kind of, as my next evolution, to go out into the field. So I did that by going on a trip to Vietnam in the Ha Long Bay, and I went with the Flying Doctors of America. In my clinical practice, when I first started, I worked with children and families, so I was sort of a natural to work with this fellow here you see in this image as a pediatrician. And we worked in a hospital that was built by the French 100 years prior, and it had no electricity in it, had no running water in it, and had no glass in the windows. So we just kind of had to make do with what we did. And in the process of doing that, I just really, it was like one of those experiences that I'm sure many of you have had, where it really sort of changes you. It changes your perspective, and it changes some of the focus that you have on the work that you do. And I think for most of us, it helps push that work and helps in also perhaps our personal growth. And it got me interested in looking at diseases of poverty. And I think it was also one of the tipping points or turning points for me to start to look into global health and the kinds of aspects that from a diplomacy, from a social sustainable development kind of perspective as well. So just a couple little quick statistics. Around 30,000 children a day die due to preventable diseases caused by poverty. About 500,000 children become blind each year from malnutrition. 1.8 million people die annually from preventable diarrheal diseases. And while, it's very important to be able to treat the ill, there's a variety of different kinds of proven prevention strategies that actually aren't even in the healthcare space, so to speak. Those things would include economic development, ending military conflicts, developing educational models, especially for females, technology leapfrogging and access to information, such as finding markets for goods and materials and agricultural, and fostering sustainable development. And while these aren't per se medical in orientation, I feel like that's something that psychology can bring to assist in these different kinds of areas quite strongly. So I think it's also important that sometimes one passion can pivot to another. So kind of back to all those roads that I started off with in the beginning, one of the things I did as a hobby and still do just a little less assertively is I like to climb. And in the process of doing a lot of the climbs, I felt like the training tended to be fairly individual. It kind of took me away from things and almost in a sense sort of felt somewhat selfish. So I started doing climbs that would sponsor different kinds of NGOs. We worked with War Child, we worked with some other international organizations that for every climb I would do it as a sponsored fundraiser for those entities. And we developed something that we called Summits for Others. And then on one of those climbs, I was wanting to do what's called the 7 Summits, climb each of the tallest mountains in the 7 continents. And the first one is a common starter for people is in Tanzania. And on that climb, I met this fellow in white. He was actually working his way through seminary at the time. He's now Father Alois Uru, and this is the early 90s that he and I first met. And we literally became sort of paper and pencil pen pals. It was pre-internet days and pre-email, and even with the advent of that kind of technology, it wasn't quickly adopted in the area that he was at. So we'll talk about how this sort of got me into a different direction. And kind of back to my road metaphors, I write a lot in the humanitarian space for LinkedIn, and this is one of the things. LinkedIn has an editorial calendar for influencers that they want you to write about certain kinds of topics, certain times of the year, and this is one of the things of a career perspective about what's the best mistake that you've made in your career that's made a difference in terms of how your career path has gone. And it wasn't really a mistake, but I really kind of felt like I didn't ever take a class in NGO development. I never took a class in humanitarian intervention, and it never really was something that per se I thought that I would be doing in my career as a clinical psychologist or as an academic, but really sort of led to what I now kind of refer to myself as becoming an accidental humanitarian in a almost kind of a inadvertent Mr. Magoo kind of way. So for me, what had happened was I did more missions with Flying Doctors of America. I got involved through the World Economic Forum to be involved with other kinds of projects. And it just sort of, this was kind of going on parallel to the other activities that I was doing in my life. And my mentor at the time, who now continues to be a dear friend, said, you know, if you're funding all this yourself, you're doing all these kinds of things and sending in donations and doing all these kinds of things yourself, you need to start a 501c3. And I said, that sounds fine. How do I do that? And then he and his wife, who are both attorneys in this area, helped to put that together for us with the IRS here in the United States. So that was great. That was something that was kind of done for us, done for the center. But I still didn't quite know how to run it. I didn't know how to manage it. So I went to some of those same people that I knew were running their own nonprofits and, you know, said, I wanted to pick your brain. I want to know how it was that they were able to do what they were doing. So I had at the time about 6 very wonderfully energetic and excited students that were interested in the humanitarian space and nonprofit work. And we basically kind of went through my Rolodex of people that I'd had a relationship with or institutions that I was very in awe of, like Amnesty International and Doctors Without Borders, and contacted them and said, you know, we'd like to do an interview with you. Some people did an interview and with the students or myself, or they chose to write their own chapters if that was their preference. And one thing led to another, and it started to grow and started to grow and grew beyond the size of one book. And then we created what we called the New Humanitarian. So these were nonprofit NGO organizations that were working, and you can see the first book was devoted to global health. The second book was devoted to education and relief. And the third was sustainable development and social justice. So each chapter is a specific standalone chapter that focuses on Doctors Without Borders or Amnesty International, et cetera, but also not just the big names, the brand names, but also some very small startups that most people probably wouldn't have ever heard of, because I wanted to find out, how did the big ones become the big ones? Where did they start? They were very open and very transparent about misstarts and missteps and how to, you know, here's some, you know, pitfalls to be able to avoid. So in the context of this, I found not only great technical information and how, you know, from a leadership and management perspective, but also some just wonderful inspirational stories and some great creativity. And I want to share 4 of those stories with you. The first is a friend, Bill Rosenblatt. Bill is an anesthesiologist at Yale New Haven Hospital. And one of the things that Bill found when he was working in the OR was that a patient would come in for a certain kind of procedure. A kit of tools would be there for the surgeon to use, and maybe a third of those tools would be actually used in the procedure. The 2/3 of the other tools were still totally sterile, had never been touched by the surgeon or never used with the patient. And the result of the used tools and the not used tools all became medical waste. And a lot of medical waste has to be incinerated by certain states' laws, which then creates another kind of pollution problem, creates a huge waste problem of materials. And for hospitals and facilities, biomedical waste also has a premium in terms of waste disposal, so it creates an additional cost. And it keeps these materials and equipment that could have been used someplace else from being used. So while Bill was very clever with this, I think he has the most creative acronym for his nonprofit. The nonprofit's called Remedy, and it stands for Recovered Medical Equipment for the Developing World. Now, I think he kind of cheats on Y for world, but nevertheless, what he does is really terrific. So he actually lobbied the state legislature in Connecticut and had exceptions made for the materials that were typically destroyed and creating all sorts of problems, from an environmental perspective, and got a number of volunteers, medical students, residents, pre-med, et cetera, to get these materials and to then be able to sort them. And one of the last times he and I talked, he said that he feels his sweet spot is Nicaragua, and he feels that he's probably been responsible for 2/3 of the medical equipment that's gone there to be able to help aid with surgeries. This is Ethan Zuckerman. Ethan is now at Harvard, and he's just a hysterical guy, brilliant guy. He sent me this when we were putting together the book. I said, hey, we can have some images in this. This is him in Ghana, and he said, here I am in Ghana. I'm the one on the right. So it sort of, I think, speaks to his humble nature and his good sense of humor. Geek Corp is not to be confused with Geek Squad, but basically, when Ethan founded this, the problem that he was addressing was in a variety of different kinds of medical settings or educational settings, when computers get donated, the computers make their way over to wherever it might be in a developing world country. And as I have experienced, I'm sure many of you on this webinar have experienced, you plug in your machine and you can't get it to connect to the printer, or you can't get it to read something, or you have a problem loading some kind of software, or you can't get it connected to the internet, etc. Well, for us, it's a frustration, or maybe we call someone in tech support, or maybe we have an 800 number that we call to get troubleshooting for whatever our problems are. But those machines going over to Kigali, Rwanda, that 800 number isn't going to be of help. There isn't someone there that they can call up and be able to do that. So Geek Corp worked with a number of hardware manufacturers to say, when you do a donation, let us know, and we will, a day later, after the equipment arrives there, we will come there and help set it up and put it together and make sure that everything runs. And it really, but prior to talking with Ethan about this, it never really occurred to me that that was a problem. Now it seems very obvious, but then also the fact that they were able to do that, identify that problem, and then be able to get a volunteer team of people over to make those wonderful donations actually work the way they're supposed to work. Eva Harris is a amazing person. She wrote this book, A Low-Cost Approach to PCR. PCR stands for Polymerase Chain Reaction, and basically it's sort of a DNA-based way to be able to do a differential diagnosis of infectious diseases, so viruses and parasites and bacterial infections, etc. This is extremely important in the context of areas where there is infectious disease, and the ability to treat that in terms of an economic way, or the appropriate use of resources, really depends upon a lab test, really depends upon lab results. Oftentimes there will be volunteer physicians, or there will be medication donations, etc. And if you try to make just a clinical diagnosis about differentiating between an infection or a virus or what have you, you really do need to rely on a blood test to properly treat the patient, to not iatrogenically create a problem by giving them the wrong medication, etc. So Eva came up with a way to be able to do that from a very low cost kind of way. And in this book, the majority of it, 90% of it, talks about the biological aspect of that and kind of how you do that. And the last 10% of it talks about sort of like her approach to MacGyvering developing a lab. So while you might read this book and you think this is really terrific and now we can do this in our labs, she then was bright enough to know to do the next step, which is how do we develop these labs? Her sweet spot is Colombia. You can see in the lower left-hand side, Bogota there. So she put together not only this book, A Low-Cost Approach to PCR, but she also put together training programs and education programs where people in these developing countries, developing areas at the time, I wouldn't classify Colombia as that anymore, and was able to establish these labs and be able to figure out how to equip them pretty much on a shoestring, where the chemicals would be the primary thing, where there would need to be the costs, but not necessarily the equipment. So it created a much better use of diagnostic tools, a much greater use of therapeutic medications, and diminished misdiagnosis and mistreatment. I'd also like to talk to you about Shobha Maybelle. Shobha is just amazing. She is the daughter of Raj and Maybelle. Maybelle has sadly since passed away, but basically Raj and Maybelle, physicians, came to the United States, I believe, to get their training, went back to the Jamkhed region of India to create their clinic. And in the process of that, had Shobha. Shobha then came to the United States, trained at Johns Hopkins as a hand surgeon. That was her specialty. When she came back home to work, kind of her subspecialty was to work with young ladies, pretty much her peers. And these women would come in to the clinic with perhaps vague symptoms. They had stomach aches, they had nausea, whatever. And they'd get into the clinic privately with her, and they would find that it was actually, the issue was depression, anxiety, relationship problems, parenting problems, etc. And Shobha realized that while her training was wonderful and what her specialty was, it wasn't really addressing the needs of these women. So being the kind of person she is, she went back to the US, got a master's degree in counseling, and then was able to feel better equipped to be able to manage the issues of the women that were coming to her office, be they more psychologically based or more medically based. I'd also put in a plug. We have a collaboration with them that people that are medical students, graduate students in social work or psychology, pre-med, et cetera, are welcome to come there very inexpensively and be able to get credits oftentimes to work in their rural clinic, which I highly, highly recommend. Victoria Hale started Institute for One World Health, and one of our first conversations, she had just gone to the IRS with her attorney, met with 4 IRS attorneys, and the reason that they had the meeting was that the IRS could not believe that she was actually establishing a nonprofit pharmaceutical company, and that's exactly what Institute for One World Health does. Victoria and I work together with this group. This is in Benin, and these are a number of native healers, natural healers, who use plants by virtue of their medicinal properties. And they have a variety of different kinds of suspensions and powders and liquids and things like that. And the idea is that we would collaborate in an ethnobotany way with the university there in Benin to be able to identify these kinds of compounds and do the research on them to look at better dosing, minimizing toxicity and side effects, et cetera. And then Victoria would use her, like if you think about R&D, we would do the research side of it, and then she would do the development and help bring those medications to market. The nice thing about it, and being a non-profit pharmaceutical company, is that all of the intellectual property and the royalties would then be able to go back to those natural healers. They wanted to use those funds to then be able to buy more area to create sort of these botanical gardens, if you will, of protected areas to fight back against the encroachment against development there in Benin. Global Medic Force is sort of the medical version of what we saw with Ethan and Geek Corps. Marie Charles is a physician. She's based out of Holland. And basically, if you think about when you're doing development work in the medical side, you might have donations of equipment like Remedy. You might have collaborations with healthcare providers like Flying Doctors and Doctors Without Borders. But if you think about a surgical circumstance in a hospital setting, or if you think about like someone needs, perhaps plasma, or someone needs a certain kind of tool, or you need to keep track of how a patient's treated, you need an electronic or some kind of medical record. That's what Marie does. She provides the infrastructure through what her nonprofit called Global Medic Force. Her sweet spot has been in Vietnam. And basically, when you've got people that are being trained to be, physicians and therapists and nurses and allied health, et cetera, the infrastructure to be able to help them do their work in their hospitals, in their clinics, is what Marie Charles and Global Medic Force does for you. So I just want to kind of share kind of the experiences that I had and some of the inspirations and contacts of people that I highly respect, who are just salt of the earth kinds of folks. And in the process of that, I really learned that there's no fixed set of rules. There really is no set path that one has to follow, or a degree program or something like that. There's a variety of different kinds of ways to get to the ends and means that humanitarian intervention requires of us. I also want to kind of give a plug. I'm just a big fan of William Easterly. He's an economist. He wrote this book a few years back that I really found quite inspirational. Again, I highly recommend it. It's probably been out for more than 10 years now. But he kind of did it as a tip of the hat to Rudyard Kipling's piece, The White Man's Burden, and took a look that a lot of the large institutions that we have today, even the United Nations, hit a tipping point where they get very bureaucratic, they get very structured, and it becomes very difficult for them to be able to do the kind of work that they want to do. And this really is the power of the small project, which really inspired me, that we don't have to be huge, gargantuan, high budget, high profile institutions. We can be more specific and hands-on and boots on the ground, so to speak. So I want to now talk to you in detail and introduce some of the tools, but set a context for the nonprofit that I did and the pivot that we had to make. This is the shot of our website, Center for Global Initiatives, and kind of tells you what it is that we do and kind of what we're up to. We have a project section, and this tells you some of those. And India there, Worldwise, is the project that we're doing in collaboration with JOMCAT. And everything seemed to be, going quite fine. And we were, all of these projects too, I should say, are people that have come to us asking for our assistance. We don't throw a dart on a map and say, oh, let's go to Tanzania or Bolivia or something like that. And at one point, probably about 5 years into our program, our existence, this couple from Ukraine came to us and said, we would like to collaborate with you to help out on a 3-year project, a 3-year grant-funded project from USAID to do work in what are called internats. And they're basically orphanages for people with profound cognitive or physical disabilities. So we went to work and collaborated with them, and we had some meetings, and we found that if the grant was funded, it would require someone to go to Ukraine for 3 times a year, 7 to 10 days at a time for 3 years, and administer like moose ward atmosphere surveys and a variety of other kinds of evaluative things. And when our board was discussing this, we all kind of looked sideways at each other and said, I don't have that kind of time off. I should also mention Center for Global Initiatives is totally volunteer. None of us get paid a nickel. Everything's volunteer. Our website's done by volunteer. The people that got our 501c3 is done by volunteers. Everything that we can do to be volunteer time donated, it is. So we all have day jobs. We all have other expenses. So we all said, I can't get that kind of time off. Even if I did, I can't burn up all my vacation time. My family would kill me, et cetera, et cetera. So we learned that we really needed to do a pivot from there. And our pivot was to really kind of focus on one key project, which has now become Tanzania, and kind of share with what we've learned through our process. Our chairman of our board, a wonderful fellow, Dale Galassi, said that we have learned a lot in our 5 years that might help a lot of others to not have to spend 5 years to try and do that. And basically to help accelerate them, to reduce the friction in doing whatever kind of humanitarian work that they had. We kind of reframed that as saying, hey, we want to really open source humanitarian intervention. And the fact being that it shouldn't be so difficult to be able to help others, which I'm sure some of you may have experienced that it can be. What we found is that basically people that were now coming to us broke into one of two categories. They either wanted to start their own nonprofit or non-governmental organization. So we coach and teach people how to do that. Or they wanted just to work on a project or to do a specific kind of work. So we helped them by being a fiscal intermediary. Some people said, hey, there's this one thing I want to do. I want to, get this well dug, or I want to do X, Y, Z. I don't want to develop a board. I don't want to wait a year through the IRS and, get non-governmental nonprofit status. I don't want to, create bylaws, et cetera, et cetera. I just want to dig a well. I want to get water to these people, what have you. So on our website, and I encourage you, I'll put the link up at the very end, that's centerforglobalinitiatives.org. You'll see an area there called DIY humanitarianism, or do-it-yourself humanitarianism, that will talk about these different kinds of projects. And regardless, even if you're not necessarily interested in either of those things, the work that you're currently doing, we have a number of tools that may be helpful to you. So back on our website, if you go to the tools area and you click on it, you'll see the first thing is looking at fundraising and internet tools. The second thing is flight discounts. And what we found in our experience, and when I would give talks and things, that a lot of times people basically want to find out the things that are in this Excel file. So if you were to click on that link that I just showed you in the prior slide, it would open up an Excel spreadsheet. That Excel spreadsheet is yours if you would like it. You can download it, you can edit it, you can do whatever, except you can't break it and you can't re-upload it back to our website. So you can do whatever you want to with it. If you do download it, and if you do want to take a look at it, the top in the red circle, it says, it lists, we're in the tab of donors and donations. It lists the name of the organization, their website address, what they do, Is there a transaction fee for what they do? Do you have to be a 501c3 to be able to use their services? Opinions, this is if we've used it or any of our colleagues have used it, any other kinds of notes that we have. So we try to build a little community of this. We haven't used everything that's in there, but if you go out and use it and have an opinion about it and you send that opinion to me, then we will update our spreadsheet. So we try and keep this as a live document. And if you look at the blue circle at the bottom, these are the different tabs that are in that Excel file for you. So we've got charity databases, donors and donations, fundraising, grants, important websites to know about, raising awareness in this space, resources and tools, and managing volunteers. The other link on that page takes you to a place called Fly for Good. And I found that in humanitarian work, one of the biggest problems is being able to get back and forth to a country. Usually when you're in country, it's pretty inexpensive. So this is sort of like a humanitarian Expedia, that the sole thing in their database are places that have humanitarian airfares. I still check out all the other sites as well too, and probably a third of the time, this is a good site to be able to use and to reference. We also, if you're interested, if you're active on Facebook, we have a group that you can join there, Center for Global Initiatives, and we have, I probably post on this 3 to 5 times a week, depending upon kind of newsy kinds of things, what's come out, infectious disease, something from World Health Organization, et cetera. So please just come there and be happy to have you join. Back to the Center for Global Health at the University of Illinois at the College of Medicine there. We have this website to kind of help coordinate projects. We find that oftentimes people have a difficult time of knowing how to connect with other people that may be working in the same geographic area. So if you go there and you go to the projects page, you'll see this map. And on that map, you'll see all these different tags. And if you're to click on the Tanzania one, you'd see a number of them, but this is the one that we have. So you don't have to be involved with the university. You can just let them know that this is a project that you're doing. It'll pull up what the project is, and it'll talk about, like it lists my name, and the Center for Global Initiatives is a link, and it'll take you to our page. We also have a very large Dropbox library. Honest to goodness, I think just our table of contents is about 8 pages long. So if there's areas in there that you would like to have information on or whatever, just shoot me an email. I'll be happy to give you the link of that. I also do a lot of presentations. This talk today, these slides are available on SlideShare. So just go to SlideShare and put in my name. It'll take you to a page that looks similar to this, and it'll have all the presentations that I've done. They're not all in this area because I speak in technology and other areas, but those are all slides that you can take a look at, as well as some videos and infographics and reprints and documents. So again, all freely available to you. You don't even have to, I don't think you have to be a member of SlideShare. We also have a newsletter that we put together and archived. It's called Tools for Change. It's on the platform issuu.com. So again, just go there, stick in my name, and you'll be able to see all of these and be able to download them or take a look at them as well. We also, because I hate fundraising, so I like to do it and put together some skill sets like the climbs, but we also have produced 2 books so far. One's called the Humanitarian Field Guide, we did a while back. And more recently, we've done Why Global Health Matters. This actually has its own website. So if you type in Why Global Health Matters or type it in .org, it'll take you to this page. Very excited about this. It's a very large book. It's a wonderful resource tool. Both these books are available on Amazon. And we were very fortunate to have Jody Williams, who some of you may recall won the Nobel Peace Prize for her work in landmine eradication back in the late 90s. We have over 45 contributing authors, and you can see a full table of contents and who those authors are and whatnot if you go to that site. And I should also note that all royalties from both those books go to support our work. So we've also developed a podcast, as Falu mentioned in the intro, called Living a Life in Full. We kind of have a humanitarian thread that goes through all of those, the guests that are on the show. We post the first of every month, and then we've got a special series right now on global humanitarian work that is happening mid-month through folks that are working at the Chicago School of Professional Psychology. So we're on all sorts of platforms. This is a minor list. This has actually, believe it or not, been updated. So if you enjoy podcasts, just about any platform, you should be able to download and listen to ours. Again, all free of charge. So I mentioned about outcomes. early on. I kind of want to wrap up and be able to take some questions. But basically, we started a kindergarten in Tanzania with my dear friend Alois. 40 kindergarten children were able to join primary school through that kindergarten. It's planned another 40 kids will be able to get registered once they're 6. 21 new students were able to get registered into the kindergarten. 22 of the orphan students that are there that we've supported were able to pass their national exams in primary school and able to now go to public schools. 11 girls passed their final secondary school exams, and 10 of the top scorers were selected by the Ministry of Education to join their special national government program, which we are just super, super happy and with that collaboration and the success that they've had. We also work in the healthcare side of things. We work with 2 hospitals there. Alois, who's also in charge of the kindergarten, bless his heart and soul, is also chaplain at these 2 hospitals, and they kind of field everything. And one year there was an issue with a malaria outbreak, and while it's very understood that repellent treated nets are the best way to do that, that's true, but it's not helpful for those that are dealing with malaria. And those 2 hospitals had a population of around 4,100 people that were suffering with malaria, and we were able to get funds over there to buy in-country medication to be able to treat it. 28% of those infected were children under the age of 5, which are a hugely vulnerable group. So when we calculated the cost of what our donations were and the number of lives that we were able to treat, it resulted in a cost of 73 cents a life. So just really sort of amazing how funding can go. I wrote that up also for LinkedIn, and if you're interested in it, we published it back in 2016. It's called When It Only Takes a Few Pennies to Save a Life. So final things, in terms of third-party credentials, so this is not only us, but I also recommend this if you're looking to work with an organization or donate to an organization. These are kind of the top 3 that are on my list. I'm sure there are others out there that, that you may like as well. This is called Great Nonprofits. They have a number of endorsements, sort of the criteria and certain levels of transparency to be able to get endorsed with them. We are gold level status with the GuideStar, and probably in my estimation, GuideStar and Charity Navigator are probably the top 2. Oftentimes you can, on these, be able to see tax records and things like that. All tax records for nonprofits are public, et cetera, et cetera. So if you're looking to get involved, if you're looking to get a job, if you're looking to collaborate with someone and maybe you don't know them real well or whatever, these are wonderful ways to kind of see what their rankings are and see what their kind of what goes on behind the curtain. So what's next for us? We developed a consortium for humanitarian intervention. We've got that available also on Issue if you want to read about it. We also have a site. It's a closed group, but just ping me. You can come join it, and we can tell you more about it also on Facebook. So the goal is to have a variety of tools available to you all to be able to open source humanitarian intervention. And I've really found that people in the psychology space, whatever stripe and specialty of psychology, has been able to do a remarkable amount of good. So for today, I really appreciate you having me. Please do keep in touch. My personal website is simply drchrisstout.com, or the website where I showed you where all those tools were and things is centerforglobalinitiatives.org. So go do great things. And again, thank you for your interest today and being part of this webinar.
Thank you very much, Dr. Chris Stout. That was an excellent presentation. It was very informative with a lot of great tools and a lot of projects that you're involved in. So I wanted to start off with one of the first questions. Sorry, just give me a minute here. Miriam Tefra, she has a question in terms of how you manage your time to do everything that you're doing. If you can give some tips around that. And then,
sure.
And then there's also another question in terms of peace and diplomacy, referring to the 2 books that you mentioned. Have you been involved working with governments and policymakers?
Okay, great. Good questions. Thank you both. First question, part of this, I mean, it probably feels like a bit of, drinking from the proverbial fire hydrant, like it's a lot of stuff. But the aspect of it is that all the things that I presented to you have been over the course of decades. Some of those first books and the first projects and things, date back to the 90s. So don't feel some kind of obligation that all of a sudden, all this stuff has to happen, immediately or at once. One of the things in the NGO space is to be really, really patient, but to be really, really dogged and keep up with it. I would say that in terms of maybe a hack around time management is, just be as organized with whatever kinds of tools that you use to be organized with, but also to try and get double duty out of things. And what I mean by that is like having an academic setting that might support graduate students doing work like the new Humanitarians work, where they could get credit for it. They got publication credit for it. They got academic credit for it. So it was a win for them. It was a win for their school because that got notoriety of their students. It was a win for the organizations that got interviewed, that they could be part of the book and get that kind of exposure. And it was a win for me that I could then learn about, well, how did XYZ organization develop and do their work? I could not have interviewed 45 different organizations and created 3 books by myself. So it's really trying to look at opportunities to have good leverage and to try and do multiple good things with that. Like for that, I think is a good example of just simply one project to be able to do that. So, and also I'll tell you, I didn't talk about this, but I also, this may sound a little kitschy, but I have a board on Pinterest all on productivity. So, just go to Pinterest, stick in my name and stick in productivity, and then you'll see a lot of very specific, more detailed kinds of ways of time management and technology tools. For the second question, sort of yes and no. For a period of time, I worked with state government. I consulted through both Northwestern and University of Illinois for the Department of Human Services in their division of mental health. So it was really not so much on the political side, I'll get to that in just a second, but it was on the side of working with individuals that needed to come to state psychiatric facilities and to make sure that they had appropriate kinds of treatment there. On a step out from there was I was involved in my state in Illinois with the state legislative advocacy, and then with APA through federal advocacy to be able to push policy that looked at social determinants of health and mental health parity and things along those lines. On a more global level, it was like with in Tanzania, to get that kindergarten established, the materials, I didn't go into the detail in this, I just summarize it, and anybody can email me, I can give more details about anything if you'd like, but we put together a set of materials that then went from us to Alois for tweaking for cultural appropriateness, and then went to the Ministry of Education. That eventually resulted in our getting the kindergarten approved by the Ministry of Education. I have worked also in Cambodia with their Ministry of Health and some kind of tangential work in Rwanda and in South Africa with ministries of health, and had very challenging, very mixed kinds of experiences with them. So as you might in the United States as well. So yes, and then the whole side of things, looking at peace and diplomacy. I'd encourage people to get involved. Certainly, Division 52, Division 9, SPICY, and Psychologists for Social Responsibility are all great places there to be able to get maybe more politically involved and active. Sometimes, just as a caution, you might need to be a little careful with that in certain countries, that you could kind of, you don't want to be seen. Like I've got a colleague right now in our center, a volunteer that's working in Tanzania primarily, and we have to be very cautious to not look like we're siding with one, side of government or another. So the politics of things can be very different. I was doing also some work in Nigeria, and things can change very, very quickly in a blink of an eye. So again, if those are issues or concerns, if some of you are working in those different geographic areas, again, just we can back channel and have a separate conversation or email.
Great. Thanks so much, Chris. I have another question from the audience. Do you see the world changing in terms of humanitarian efforts?
Ah, gosh, great audience here. Great questions. You know, it's personally, you know, I would be very impatient. I mean, I see just so much to do, and sometimes it kind of, you know, just feels like a Sisyphean act, you know, climbing up the hill and sliding back down. But I guess, you know, there are pockets and there, I think, are very hopeful areas. It maybe goes back to the Easterly book that I made reference to. I think there's a lot of great work done at the grassroots level. To give a little plug for Chicago School, I think that through their international psychology program, and even outside of that, with student experiences and doing serious work on sustainable projects is a wonderful direction. I know there's other schools and institutions doing that as well. I think APA, through the divisions, and obviously 52 in particular, can be great places and resources to be able to see where can we partner, where can we collaborate, what grassroots are going on already. And again, like most of us psychologists, we like to look at outcomes. So what kind of successes are they having? Where are the speed bumps that they're experiencing? What are the workarounds? What are the things that we can do around that? And honestly, you know, like the 73 Cents of Life, sometimes it doesn't take, you know, a huge amount of resources to, you know, have an asymmetric impact on whatever it is that the work that you're doing. So I would encourage you, you know, some of you, so I've had conversations with a lot of people that say, well, I have this project, I think it'd be really great. It's really something that's near and dear to my heart, but, you know, I don't think it's, you know, it's not, you know, going to change the world. It's not going to, well, it may not change the world, but it may change a neighborhood. It may change a family. It may change, you know, a region or what have you. So in those instances, don't be overwhelmed by what might seem like a lot of the work. Please come, use our resources, you know, bend my ear. That's what I do with this. So, you know, I would just encourage people that I do have great optimism for this sort of thing. It's not always a straight direction. It's not always an easy course, but I think there's enough good people out in the world to be able to help others and to be able to make a difference at a, you know, maybe a small micro level. Don't feel like everything has to be, you know, UN level kinds of change.
Great. Thanks, Chris. I have a question. You mentioned several books that you wrote, and I was interested in hearing about your book on the integration of psychological principles in policy development, how you got started on that project, and you know, basically what the book is about.
Sure, thank you. You could probably only find it in an antiquarian bookstore these days. I think it came out probably in the early 90s. It was a perspective that kind of looking at the state of the world at that point in time. I felt that what I had learned in graduate school and what I was seeing by virtue of, you know, federal advocacy and policy development and policy change through the work with the APA and through the state work with the IPA was that, you know, if you want to look at, I mean, just, I don't mean to trivialize this, but it seems so simple and straightforward, like just reinforcement theory. And what is sustainable development, and what is social justice and social equity, all of those kinds of things, and not treating things that are treatable, such as, you know, untreated, you know, mental illness, and then letting that find its way to state facilities, and then state facilities go away to finding themselves in departments of correction and all sorts of other kinds of, you know, difficult and areas that could have a, you know, a little better dose of how we, you know, treat our brothers and sisters. That the aspects of taking those principles and have those be made to policymakers, I thought was very important. So I talked about things, even back in the Eisenhower era of the war dividend and things like that, that there's a great economic literature out there talking about post-war times, is really the time of plenty. It's the time where it's not like saying, well, if we have a war, then we can gear up and, create jobs and do all these other kinds of things. It's like if you actually take a look at that from an economic perspective, it's more so during peacetime when economic things, if you look at it jingoistically just in the United States, that we've had our booms and things. So what are the behavioral aspects to be able to get what's good reinforcement, what makes sense, what's fair, what's just, what has equity to it. And those are the kinds of chapters that I contributed. Pardon me. I also had, since it was edited, I had people from different perspectives be able to weigh in on things. So we had people from government, we had people from economics, we had people from business, we had people from the nonprofit space, and really tried to give voice, and sometimes conflicting voice, but it wasn't like here's all my opinion and I found everybody that agrees with my opinion and let's put it together in one book. It wasn't that at all. It was really kind of a diverse set of views and perspectives, kind of born, all of them had a very good grounding in making their arguments. It wasn't necessarily, because economics isn't necessarily a scientific field or a testable field, but it was kind of a way to give voice to that. But the uniting thread was to have a psychological perspective in terms of looking at behavioral economics, et cetera, in whatever it is that we do moving forward as we develop policy.
Great, thanks. Thanks for that detailed response. At this point, we need to come to an end. So if anybody has, oops, sorry about that. So at this point, the webinar has come to an end, and once again, I really want to thank you, Dr. Stout, for a wonderful presentation and so many great tips and resources. And I'm going to hand it over to Dr. Karen Brown right now.
Thank you so much, Dr. Rami and Dr. Stout, for this amazing presentation. I want to thank all those that are attending this webinar, where Dr. Stout shared some amazing information about the organizations and technologies that are doing such great work in the humanitarian interventions. If you enjoy our webinars here, please spread the word, let your colleagues know what's happening in Division 52. And for those of you that signed up for CE credit, please check your emails for the quiz that will be forthcoming. And on behalf of the Division 52 Webinar Committee, I'm Dr. Karen Brown, Dr. Falu Rami. Please have an amazing day. Thank you so much.
Thank you.